Can a chiropractor fix your nose by just cracking your skull? And is rhinoplasty just cosmetic? Let's bust some myth, ENT style. Hey friends, Dr. Bob here, ENT surgeon, and today I'll be reacting to some deviated nasal septum treatments by chiropractors. So let's see how they get this work done. Let's get into it.
Está el desvío, ¿no?
My God, that's just torture. That patients are just getting tortured over there. Who is this person doing this? It's really insanity. Like literally, this doesn't. I don't even know how this even treats for a deviated nasal septum, because they're just shoving up a finger up that person's nose, and he's gloved. But what's the point of doing wearing gloves and just putting a finger right up in the nose, hoping that it can treat? If you take your finger out after putting it in, definitely it creates space and make a feeling that there's space for him to breathe. But that can lead to trauma to the nasal septum or the lateral wall of the nose, start bleeding. It can rupture the mucosa or even the vessels, and it can just traumatize the full thing. I really don't know how this procedure is helping. So just a basic anatomy of the nose, which basically composed of cartilage, upper and lower lateral cartilages, and also nasal bone on the top. Along with that, there's also nasal septum, which is formed by the bones like the ethmoid and vomer, and also presence of a septal cartilage, which is present in the center. Along with that, it also has this area of passage of air, which is called the nasal valve, and also the lateral wall of the nose, which has the turbinates, which have bony structures which is present, which helps in humidifying the air that we breathe in. And also, last but not the least, which are presence of the sinuses, which is there. It can be the maxillary sinus, the ethmoid sinus, frontal sinus, etc. So what these people are claiming to do are for conditions where there's an obstruction in the nasal passage. So these obstruction can come because of the nasal septum, which can be deviated, or if there's presence of a nasal turbinate, which is hypertrophy of the turbinate, or if there's trauma to the nose or foreign body. All these factors can cause nasal obstruction, for which they are approaching a chiropractor to get that fixed.
So when we're looking at the nose, you can see there's a little blockage on the right side here and the left up here. But when we look at the nasal passage, the black line there, it's called a lucent line, the black space, that's air. You see how that's thinner?
Yeah.
But it's bigger there.
Interesting, yeah.
So it's like a double. The right is, but it's off on the right.
I really wish if I could see that imaging again more clearly, because it would give a better, clear image of what he's trying to explain here. But let's see.
Yeah, because I feel like both are, it almost feels like it's this way.
It's a double.
Like that.
You ready?
Yeah.
Chin down, down. There. Right maxilla, I'm holding here. There you go. There you go. Breathe in. Hi.
He's holding onto the maxilla. It's a separate bone. And how is he even adjusting a bone which is already fixed? These are having connection to the other surrounding bones. And it is not a joint or something you can move around. And more or less, I feel like the pillow is moving down, because that cushion he's just pressing over the head, and that is moving down. Nothing is happening to the bone for sure, because otherwise it's going to definitely fracture the bone. So this is again some placebo effect. I don't know if I should call it a gimmick, but definitely not a definitive cure for what the patient is having though. And also one more thing is that towards the end you can see he's kept his fingers here, which is basically called as a Cottel's maneuver, where we give a lateral movement of the skin here. Just move in here and move in here. What we want to know as physicians is that if the patient is getting a relief from the nasal obstruction, post movement of the skin, which is pulled laterally, that means the nasal valve is involved in majority of the nasal obstruction that the patient is presenting. So following which we can take up and plan the patient for septoplasty for the correction. So what I believe is that post-treatment, he's keeping his finger there and the patient gets a temporary relief, probably for a couple of hours. So they just fall in for the trap that yes, this thing serves the purpose and gets it cured, but it is just temporary. And God forbid if something happens, it's going to be permanent damage and also injury for the patient for lifelong. So definitely there are potential risk factors for this. How is he making those cracking sounds? See, it's like usually the sound is produced from a synovial fluid which is present between two bones, like at the joint basically. Like suppose this joint, where the synovial fluid has these bubbles which is produced. So when we crack our joint, that is when these bones go apart, and that is when simultaneously those bubbles break. Following which the crack or the pop sound comes, and following which it takes a couple of minutes for which the bubble has to reform again. That's later where you can crack your knuckles later on. So that is why you cannot crack your knuckles back to back. But in the anatomy that what I know, in the nose there's no synovial fluid, and it is the nasal bone which is present, and then it's the cartilage below it. How on earth is he making those sounds is still a mystery. Is he making with his own fingers those sounds when he's moving it or maneuvering? Still not clear. But definitely there's no way that you can make those cracking sounds from your nose.
What are the keys? और कल करेक्शन, उसके बाद थोड़ी सी एक्सरसाइजेस, ठीक है?
How on earth is that nasal correction? Like, come on, are we fools here? Because we do this septal rhinoplasty and we have to correct the deformity, and this person has done something and the patient is looking as if the job is done with multiple knuckle crackers. That's just sound which is produced, and I really don't know how and what changes has made to the nose. Their husband is like, yeah, finally your nose, your goddamn nose is fixed now. Stop bugging me with your life, with your nose problems. He'll be like, yeah, I save a lot of money instead of spending on surgeries to get the nose fixed, just go to this guy and he'll just fix your nose. Like, just magic, right? Trust me, don't go into that, you're getting into trouble.
ठीक है?
Again, it's just so surprising that is this a prank show or something? Is it scripted or something? I really don't know. Or maybe the patient is relieved, functional nasal obstruction is relieved. Patient is able to breathe properly, probably because of the maneuvering done. But external framework of the nose cannot be fixed. Come on, it's a bone. It's like you fractured your arm. Then you expect it to get all right by putting an ointment over it or putting spray, muscle relaxant spray or whatever to cure it, because it's a fracture which requires reduction and getting it back aligned, or probably fixing it with external fixators, screws or something, because it's a bone which is broken or it's a bone which you have to fix. Similarly, your nose also is the nasal bone which is present, which needs fixed. Cartilage, separate. That also requires correction. But a nasal bone adjustments is something really hard to digest. So if you guys made it till here, you know what to do. And if your nose is blocked, please don't go cracking your face to these people. And if you learned something from this video, don't forget to leave a like and subscribe for more.
Hai preso la botta stamattina?
Ma il cazzotto.
Male?
Sì.
Allora adesso sentirei un po' male, Dai, respira bene. Ok, è andata. Oh. Dai, meglio. Respira. Com'è? Entra più aria?
Sì, entra più aria.
Why am I watching torture videos. People are getting tortured live, and that guy is like, it's okay, relax, 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 relax. Dude, you just literally pressed his face. You were manipulating the bone. I don't know what you were doing, but literally that guy was in pain. That is where you use anesthesia, and you don't just randomly break bones over the face claiming that can do rhinoplasty. So if it's a correction of the nose, which is basically, if I'm talking about only the septum per se, if you have a deviated nasal septum and externally the nose looks fine, but you feel you're having difficulty breathing, you have a nasal obstruction, you're having nasal discharge, for that we can do septoplasty. And if it is a condition where your nose externally looks deformed, it is having different shape, the tip is not good, or you're not convinced enough, or you're not happy with your nose, that's where you do rhinoplasty. And if it's a combination of both, that's where you do septorhinoplasty.
So that came all the way out.
So what you saw right now is cranial facial release, which is a procedure by which these people, they insert a small balloon through the nose, goes to the nasopharynx, and they work it by using a pump in the hand. So they pump and this balloon blows up in the nose, following which, as you saw the balloon which is coming out through the oral cavity, and they burst the balloon out and they take it out. So what these chiropractors claim is that it can help in realigning the cranial bones, help in treating for the sinuses, the nasal obstructions, and improving the breathing, and even relief from headache, sleep apnea, and neurological conditions. What bull? So the main problem here is that there's no clinical evidence, or there's not much of a clinical trial that's done for the treatment that they're doing. And also there's a lot of potential associated risks that can happen because of it. Because again, a blind procedure, what they're claiming to do, they can traumatize the nose, the lateral wall of the nose, the floor, mucosa, it can start bleeding, it can start, and if following which it can be an infection, abscess, pus, all that can happen if it's not done the right way. So let me clear some misconceptions for you. Can this procedure move the cranial bones? So the cranial sutures are immobile, so it definitely cannot move in adults. Does cranial facial release improve the DNS? See, it's only the temporary relief that you get because of blowing the balloon in the nose. And definitely it's a structural deformity, it requires a structural correction. Can CFR release sinus pressure? See, it's only a placebo effect because of which the patients are claiming that it is helping. Or it is probably a transient nasal decongestion that's happening because of this balloon that's blowing up in your nose. Does CFR treat neurological conditions? Well, there is no neurological society that supports this whatsoever. So the bottom line is cranial facial release is not scientifically validated and also not ENT approved. So if you have a nasal obstruction or deviated nasal septum, please refer them to an ENT, not to a balloon pump. Here are some fascinating facts about deviated nasal septum. 80 to 90% of people are already having deviated nasal septum and they don't even know it. It is something which only and only if you have a nasal obstruction or if it is affecting you, the physical structure is affected and you're not feeling confident because of the shape of your nose, that is where you require a correction for the nose. Otherwise, small amount of deviated nasal septum I also have, but if you only have a symptom, that's when you require a cure. Otherwise, it's fine. You can still live with your deviated nasal septum your whole life. And it is this deviated nasal septum that can cause headaches, snoring, difficulty breathing, nasal discharge, nasal obstruction, etc. So the correction and the proper correction is only possible with surgery because it is an osteocartilaginous unit. So no amount of adjusting maneuver can really help it move. Though it might be a temporary movement and a definitive treatment is only by surgery. So I have deep respect for any profession that helps people to feel better and cure their illness. But when it comes to deviated nasal septum, I really have to draw a line here. Chiropractors that are manually adjusting the nose and claiming that they can clear and treat the deviated nasal septum is totally misleading and also can cause potential complications to the patient. Especially the nasal septum and the lateral wall of the nose has the minute blood vessels. It has the nasal turbinates which is present. So adjusting it and maneuvering it in such a way it is definitely causing pain for the patient and also can be fatal if it starts to bleed. What worries me the most is not just that there's lack of science, but also this misleading trust which is in the people, that believing that this is something that can cure their problem, and also because of which it is delaying their actual treatment. In the end of the day, you wouldn't do a brain surgery with a massage therapist, right? Then why trust your breathing with someone who's not trained in airway and also nasal surgeries? And if you're someone who's having nasal obstruction, nasal discharge, difficulty in breathing, or if it's a deviated nasal septum, or if it's a crooked nose, or even if it's your friend who's having all those things, please refer them to an ENT surgeon. This is not for a publicity that I'm doing, but please go with trained hands. You can ask n number of questions and go with evidence-based care. Because quick fixes fade and damages can last forever. Because you don't just need to breathe, you deserve to breathe right. So that's all for today, my friends. I hope you guys liked this episode of reacting to some crazy videos based on deviated nasal septum corrections and whatnot. So God knows what more videos I have to keep watching and reacting. So as always, you guys take care, stay safe. This is Dr. Bob signing out.